we're going to talk about the 3 main causes of hip bursitis and why your treatment is failing. Hi, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications, even when they've had failed treatments. And this is one common area that most people don't get right. And we see this all the time in our office. So this is Victoria. She's going to be my model. I'm going to kind of go through some things that we typically see with hip bursitis that people don't miss. And so we're going to go through some of those things. So we'll talk about what hip bursitis is, the common treatment failures, the common prescription from doctors, and then we'll get into the 3 main common causes of hip bursitis, and we'll show you on Victoria kind of what we see. So what is hip bursitis? So we have a lot of muscles that go in and attach into our hip. So this is kind of where the bone is, and a lot of the muscles come through and attach right into that hip. And when you have a lot of attachments in an area that attach into the bone, there's things called bursas to help things like glide a little bit better. But if things get tight and inflamed, that bursa can get inflamed. The problem is you've got to get to why is it inflamed, and that's often what is something that is missed in the healthcare system. So some common treatment failures in this area are they'll go and just get a massage thinking that's what's causing some of the pain, and often that's just treating some of the symptoms that are going on. And so we'll talk about, you'll see why that doesn't work when we get into the common causes of that. So if you don't get to why the muscle is tight, then when you release it, the pain's going to come right back again after a massage. It'll give you a good indication that, ooh, I shouldn't be going down the massage path because maybe there's something else that's causing that to be tight. The next thing that people will do is they'll go to physical therapy like, oh, you're weak, we need to strengthen it. This can make it worse, and there'll be, again, you've got to get to why the pain is happening in that area. And if you don't, what will happen is that area will be worse because you'll recruit the muscles incorrectly, because if something is not moving correctly, then the muscles can't fire correctly. If something's referring pain down to that area and then you're trying to strengthen that area, it also makes it worse. So again, that's another thing that will make you worse and is a common treatment failure. The other thing will be the doctors. The first thing they want to do when they see you is give you an injection because there's inflammation. But we have to get to why that inflammation is there to begin with. So they'll do an injection. It may help a little bit, but it comes right back again because you're not getting to the source of the problem. And a common treatment that doctors will give you, because they'll do an MRI, it'll show inflammation around the bursa, and they'll say you have hip bursitis. Now here's some medications and here's some injections, and you get frustrated because nothing is really resolving it. So the 3 main causes of hip bursitis, we're going to go through some of those. The first one is back pain. And you can have back pain that happens in through here, and it will refer pain into that hip. And so if you go in and you do a massage on the hip and you're getting referred pain in there, it'll actually make you worse. You'll be like, oh my God, that hurts. I did not feel good. I couldn't sleep because you're not getting to the source of the problem. And so if you have pain that refers in that area, what happens is those muscles will tense up and protect. And so again, you can do a massage, but the pain is actually coming from the back, and we have to fix the back first in order for the pain to resolve in the hip. And so then again, if you do hip strengthening exercises, but it's really a back issue, again, it makes you worse. So that's the number 1 cause. And we can tell when people have some back issues because we can ask them questions. Do you have any tightness in your back or stiffness in your back? And they'll say yes, but you don't always have to have pain or stiffness in the back to have pain in the hip. Sometimes you have no pain in the back, but we have to actually treat the back, and we realize, oh wow, your baselines in your hip are getting a lot better. And so then we kind of know. The next thing that is really common for hip bursitis is when your hip actually doesn't move very well. So we're going to have Victoria lie on the table, and I'm going to show you what I'm going to talk about. So she'll get on her stomach. And we test this all the time. So if I come in and I am moving the hip and it just doesn't move very well, I'll show you on this side. So you go in and like one hip can like move up pretty high and this one doesn't move very well and this one like moves a lot better. We know there's an issue in this hip. oftentimes too, you'll notice that you don't have rotation. I can't move the hip in rotation, but this side we can move a lot farther. And again, these are indications that something is wrong. So if I think of like the hips not moving very well, if we can't move the hip very well, or if it's kind of slightly rotated, it won't move in that joint. And guess what? You're not going to get your hip muscles to fire either if you aren't moving. So the first phase that we have to do is actually work on improving the hip motion in order to get better. And again, I have some other videos that I'll put in the description that will help you understand kind of what's going on and what are some of the mobility stretches that you can do to start helping improve this motion. So if the back is cleared and then the hip is actually moving really, really well, then the next phase is looking at how they recruit specifically their hip extensors, which are really close to their hamstring. You can have issues into the hamstring where the hamstring is tight, and you don't have any issues like necessarily on the outside of the hip, but you do on the hamstring part of it. It's because the hamstring is taking over. It attaches up into that glute, and the hip extensors are just above it. So the hamstring is firing a lot harder where you aren't really getting those hip extensors firing. But a common pattern that we'll see is when people try to activate their hip extensors by lifting the leg up. So go ahead and lift the leg up. What'll happen is they'll rotate out like this. And that's going to get them to fire all their muscles on the outside of that hip because they actually are rotating the hip because either they didn't have the mobility or they can't get this hip extensor to fire, and it's creating you really working hard through the outside of that hip, which guess what? That's where your hip bursa is, and that can also irritate it. So we have to start doing some exercises to really start improving the hip extensors so that these fire and these can now kind of relax and not take the whole entire load. Again, we have some exercises that we commonly share to start improving that hip extensor strength, and we'll actually share that in the description as well. But those are the three areas that will help with, are the three common areas that we see when people have problems with hip bursitis that most of the time the healthcare profession is not looking at. And if you like what you hear and you want to learn more, we put out content all the time. Make sure you subscribe to our channel so that you can be up to date with the best information that we have for you.